Good morning, everyone. We're very excited to have you here today. We'll begin in just a moment, and I will have a few housekeeping instructions for you while we wait. I'm Julie Shane. I'm the Deputy Director of the National Center on Elder Abuse, and we are facilitating this webinar today. This was a vision of a lot of amazing people that you will soon be hearing, and a little bit on the housekeeping. We have a very full and wonderful agenda today, and so to make sure we get through that, we're going to hold questions till the end, and hopefully we'll have time for a post-discussion. If we do not, we will stay on the line as long as people would like and try to respond to questions, but everything is being recorded and will be archived and posted, and questions that are unanswered, we will make sure that we get those answers out to you. Okay, all of the speakers' bios are on the registration page. If we tried to go over the bios of all these amazing people, we would be losing all of our conference time because they have accomplished so many things. So I think with that, we will begin our presentation. And I just want to express to you that this has been the world working together truly. We were going to have people from on the line from Brazil, Canada, all across the United States, and then all of you participating. It has all come together, and it's been a privilege for the NCEA to facilitate this event. And thank you to all of our speakers who brought this vision to us, and today we are bringing it to you. To get us off on the right start this morning, it is my deep pleasure to announce to you Edwin Walker, who is the Deputy Assistant Secretary for Aging of the Administration on Aging within the Administration of Community Living. Mr. Walker is a strong and experienced advocate for older persons, serving as the primary liaison with Congress on legislation relating to aging services and programs. Mr. Walker has been recognized many times over his stellar 25-year career, and he can be relied upon to represent the best interests of our seniors. It is a great privilege to have Mr. Edwin Walker share his insights today with us. Thank you, Edwin, for participating.
Thank you, Julie, and I'm so pleased to be here. Thanks to all who have helped organize today's important webinar to commemorate World Elder Abuse Awareness Day. On behalf of the U.S. Administration for Community Living and the Administration on Aging, and in particular Kathy Greenlee, our Administrator and Assistant Secretary for Aging, we're really pleased to be a participant, a real partner with each of them. Since the inaugural World Elder Abuse Awareness Day in 2006, played an increasingly active role in planning and implementing activities that call attention to the issue of seniors experiencing some form of elder. Of particular significance, in 2012, we convened a high-profile day-long event at the White House and secured a proclamation from the President to call attention to and to recognize the day. The following year, we collaborated with our friends and colleagues from Canada and the United Nations, as well as Dr. Pozniak, INPEA, AARP, and the UN NGO Committee on Aging in New York for an event at the UN and at the U.S. mission. On a global level, we have continued to promote public awareness of elder abuse, both as a public health issue with the World Health Organization and as a human rights issue with the nation's Human Rights Commission. We have always viewed World Day as a unique opportunity to shed light on the problem of elder abuse across nations, and in particular raise awareness of the unique impact on older women's health and well-being. As the world population for older adults continues to grow, the implications of elder abuse for health care, welfare, justice, and financial systems will only increase. However, despite the magnitude of global elder maltreatment, it's been an underappreciated human rights and public health problem. Elder abuse occurs in all countries across every cultural and social economic status. And we believe the solution is education and multilateral collaboration. This was really evident with the 2002 United Nations Second World Assembly on Aging in Madrid, where a number of forums were held to draw a significant amount of interest in elder rights and elder abuse concerns. Here at the Administration on Aging, we've continued our efforts with the UN Open-Ended Working Group on Aging, with NGO partners, and using the global mechanisms available to bring greater education and awareness to the issue. Domestically in the U.S., we're developing a comprehensive national framework for enhancing both awareness and response to the issues. And this really is a result of the incredible commitment of Assistant Secretary Greenlee and the other 12 federal agency partners who comprise our Elder Justice Coordinating Committee. So while the U.S. stands among other global leaders in addressing the issues associated with elder abuse, still there remains so very much to do. And that's why we're here today, to continue moving forward and to rededicating ourselves to providing our elders the care, protection, and most importantly, the dignity they deserve. Now it's my pleasure to introduce our next presenter, Dr. Elizabeth Pozniak. She is a professor emerita at Ryerson University in Toronto. She conducted the National Survey of Abuse of the Elderly in Canada in 1991, and that's the landmark survey that marked an important step understanding the extent of the problem of elder abuse in Canada. Known as a pioneer in raising awareness of elder abuse within faith communities and among children and youth, and Dr. Pontiac has conducted research and published in these areas for years. Represented Canada in the WHO INPEA Global Response to Elder Abuse Missing Voices report. She has published and presented papers at both the national and international levels. She's an honorary board member of the National Committee for the Prevention of Elder Abuse. And currently she's working with Dr. Pamela Teaster and Dr. Georgia Annisberger on the second phase of the global study, The Worldwide Face of Elder Abuse. She is truly an innovator and was the innovator and initiator of World Elder Abuse Awareness Day in 2003. And she received the Order of Canada and the Rosalie Wolfe Memorial Award from NAPSA and INPEA in recognition for her work in the field of elder abuse. And now, I am pleased to present Dr. Elizabeth Pozniak.
Thank you, Mr. Walker. I remember meeting you at the first World Day in New York on June 15, 2006. So it's wonderful to have an introduction from you and also to know that Dr. Kalasha is going to be joining us. He presided over the first meeting of World Day 10 years ago, and also Susan Summers. So it's really magnificent that we have several people who actually were at the inaugural launching of World Day. And since that first World Day, the world has become a much smaller place because we have been able to include countries that had not been involved in elder abuse prevention until that time. And it's significant that today is really not only a landmark for World Day, but also it's marking a milestone in as much as this is the first webinar totally devoted to the recognition of World Elder Abuse Day. And we sincerely acknowledge Dr. Moscato for making this possible. And the events that have occurred on World Day over the years are truly astonishing and unbelievable as we look at some of the things that have been accomplished. Who would have thought 10 years ago that now the White House would be lit up in purple on June 15th? The same is going to happen at the CN Tower in Toronto, and there are many other cities that are lighting up with purple to signify that it's World Elder Abuse Day. The number of activities we couldn't begin to tell you about, but I'm sure many of you have heard of them and know what they are. And the reason that all this is happening is mainly because of social media. I remember 10 years ago we were using fax machines, and some of you will recall that skinny, thin fax paper that would disappear, the writing would disappear very quickly. Now we are talking worldwide here and using all the communication and technology that is now available to us 10 years later. We have to mention a little caveat that there is a darker side to social media that we have to bear in mind, that there can be things such as invasion of privacy and cyberbullying. But if we keep that in mind, we are able to go forward into this age of technology and utilize it in the prevention of elder abuse.
Thank you so much, Dr. Pozniak. We really appreciate you kicking us off on such a great note. And now it's my distinct pleasure to introduce to you Pam Teaster, Dr. Georgia Atzenberger, and Raven Weaver, who will bring us up to date on the pilot study that Dr. Pozniak mentioned.
Thank you, Julie. I'm so pleased to be here today. This is Pam Teaster, and we will be presenting between Dr. Atzenberger, Ms. Weaver, and myself about the pilot study that we've been conducting for a bit of time. I want to reiterate what Edwin Walker said, and that is that Dr. Pontiac was one of the co-PIs of the study that we're doing, and so is right with us as we present on the findings of this particular study. Our plan of the presentation is such that I will kick us off with some background and methods, and then Ms. Weaver will talk about the findings with a little bit of me, and then Dr. Atzenberger will conclude in her wonderful way of talking about the discussions and conclusions that we will have from the findings thus far. So the Worldview Scan on Elder Abuse was the first large-scale global survey of elder abuse and obtained more information from more respondents representing more countries than any previous study of its kind. It built on early work that resulted in the document Missing Voices. Respondents came from developed and developing countries in all regions of the world, a real research first. Unlike earlier investigations, the scan did not narrow its focus to one particular single kind of abuse, professional context, or respondent type. Our aims were twofold: to understand the nature and response to elder abuse, and to serve as a pilot project leading to more in-depth investigation and expanded collaboration with countries globally. It was a labor of love and a collaboration of many individuals, particularly Ryerson University, Cleveland State University, and the University of Kentucky, as well as international organizations. The study was translated into Spanish, French, and Japanese, and included both open and closed-ended questions. Of those questions, issues concerned elder abuse itself, legislation, services, what resources were available in countries, what training was available on the topic, and also research. Not only had any been conducted in that particular country, but a willingness to participate later on down the road. It was, in fact, the broadest inquiry into elder abuse to date as a problem of international interest. And a big shout out, and Susan Summers will talk later, it was sent to the membership of NPIA, International Network for the Prevention of Elder Abuse, of which Susan Summers is now president. Highlights from the study are these. You will see 53 countries from the World Health Organization regions responded, a total of 190 surveys and 362 respondents. Highlights from the study were these. Elder abuse was recognized as a problem that exists in all responding countries. There was no single definition, but applied was the International Network for the Prevention of Elder Abuse definition and the National Research Council. That's what we began to see. Poverty and lack of social support were considered leading causes of elder abuse in many developing countries. Living alone and lack of social support were seen as elder abuse contributors in developed countries. So we began to bifurcate the data in that way. Both professionals and the general public seemed to lack an understanding or awareness of laws that protected older adults, and current laws were absent at all levels. There was little specialized training and research on elder abuse outside of a few select countries, such as the U.S. and Canada. Different agencies were responsible for addressing the problem, most typically NGOs in developing countries and social services and the police in developed countries. Respondents, and I think this goes to something that Dr. Pozniak said just recently, respondents identified a need for internet access for knowledge exchange, and that, of course, has only continued to develop as time has gone on. Study methods. Before I talk about the study methods, I think I would like to talk just a moment about the lessons we learned from the last study. First, I think the biggest one would be for all of us, studying the world represents a lot of challenges in trying to conduct a study. It was not always an indication, for example, for the respondents as whether the respondent was acting as an individual or from a group or how many comprised the group. Some difficult translations were difficult to read due to the ability of the translators, all of whom gave their time to do that, or writing skills. Some items in each survey problem, for all of them, some items were not completed. Some files were damaged by the time that we were able to receive them. We were not able to verify the translations necessarily. It would have been a huge cost we could not have incurred. The response of one person was treated as the same as that of a group. If there were multiple respondents, the way that we decided to code those data as a single answer was that the majority or better had to agree on it as the country's response. We did not provide particular weight to the knowledge level or authority of any respondent. And so those were lessons that we learned. And so we began as early as my email, as a search of my email on the topic, Georgia and Elizabeth, looked to be around 2010 that we began to have lots of conversations about this issue and the fact that it was time to move on to another scan to develop our knowledge. And so we began to try to understand elder abuse and try, because we were most interested in this piece, to put a face on the problem. And so over time and over lots of conversations, we began to think about another study, its aims being these. We wanted to increase our numbers, both in terms of persons themselves and representations of countries that we had. We wanted to expand a group of experts and expertise in this area and wanted to try to help forge related national multidisciplinary teams as part of a way to respond to the issue. And then we wanted to explore areas that weren't talked about so much as in respect to elder abuse, recognizing from the first study that what is elder abuse in Canada, for example, may not be elder abuse in Nigeria. And so we began to think about how in the world we might put a face on the problem. And so we decided that what we would try in this particular study would be a case study approach, because that would be a way to put a face on the problem. We asked teams to complete for a unified answer so we could learn from what I just spoke about before. We asked questions about risk factors, interventions, and consequences, and we made even the completion of the survey that we really have to include more creativity, including pictures and drawings that could be sent to us. And then we did phased pilot testing instead of sending it to the world, which we have later done. We enlisted the involvement of the wonderful Greg Shaw and his International Federation on Aging to help us send out some information. And of course, because it was a research project and some of us have moved around a little, the study was first approved at the University of Kentucky and later at Virginia Tech by their institutional review boards. And I want to tell you that they were somewhat flummoxed by this particular study and I remember long discussions about what does one do when one studies the entire world. And how do we address that ethically and appropriately? And so the first phase was, after IRB approval at the University of Kentucky, was to do phase 1 pilot testing. We did that in the United States through the National Committee for the Prevention of Elder Abuse, where we got 4 cases, and then from Canada, where we realized 12 cases. We reviewed the findings from that, made revisions to the phase 1 study, and then conducted phase 2 pilot testing, this being done in 2014 with other countries, thanks to the input of my co-investigators as well as Greg Shaw. Then we began to collect information from Australia, Brazil, and Israel, again looked at the information that we got, made revisions, and then again got approval for a new institutional review board as I had moved by that time, and then solicited, thanks through IFA, to other countries. And we have heard from others. We are continuing to collect those data now, such countries that we have heard from. And this one will surprise you, Nepal. So Nepal has already responded, and Nigeria and Libya are some of the countries that have now sent, this is not all, but a few of the examples of those who have sent already information from their findings, and we are very pleased by that. We are going to be doing some more solicitations and perhaps expanding our pool so we can get more respondents. Thank you. I'm going to turn it over to Ms. Raven Weaver for the study findings, and she'll proceed now.
All right, so next I will be discussing the pilot study findings. The 5 countries that were just mentioned, we received between 3 and 12 case studies per country. We started with independent open coding through the case study text, and then codes were developed within each case. Iterations of data coding occurred until agreement was reached. When the case study cover page and the text was discrepant, the text was treated as the authoritative source. Overarching themes were identified within and between cases. Abuse primarily occurred in the home and predominantly in an urban setting, and victims of abuse were in their 70s and 80s. So I'll be going over 2 case studies. The first is from Canada. This is a case where the victim was a female in her 80s. The victim had advanced dementia and was living with and dependent on one of her 2 daughters who had mental health problems. Several types of abuse were occurring simultaneously within her rural home setting. The 2 daughters were joint power of attorney. Both daughters indicated they wanted the best for their mom, but they couldn't agree on how care should be provided. There were concerns about social isolation and inadequate care. Then the precipitating event for action was when the daughter, whom the mother was not living with, when she noticed monthly withdrawals from the mother's financial bank account. She reached out for support from police, lawyers, and healthcare agencies. She sought sole guardianship of her mother. Police did investigate the fraud, but this case study did not yield or did not provide the outcome of whether the police were able to substantiate the fraud. The mother was relocated and now is living with the other daughter. Another case on the next slide is an example from Israel. This victim was a female in her 70s. She lived at home with her husband of 46 years in an urban area. Her husband was experiencing recent declines in health and was the perpetrator of multiple types of abuse, including physical, sexual, emotional, verbal, and financial abuse. During a routine medical checkup, the doctor noticed a change in the wife, the victim's mood and behavior. He encouraged her to talk with a social worker. When she did this, after a few weeks, she revealed a history of abuse where she had been repeatedly bitten and forcibly sexually assaulted by her husband. Her husband was controlling. He prohibited her from working, meeting friends, and managing the family budget, thus making her socially isolated and financially dependent on him. Their marital problems were increasing. He was becoming more aggressive and exhibiting behavioral problems, which she attributed to his decline in health. She did receive counseling, legal assistance, and attended support groups. He received counseling services as well. So these are just 2 examples from those that we have received that help us understand the worldwide base of elder abuse. On the next slide, I'm highlighting preliminary themes that we've identified from the 5 countries we've received case studies from. So we found that financial abuse occurs in combination with other types of abuse. Family members are the primary perpetrator, even when abuse occurs in the facility. Perpetrators were both male and female. Capacity of the victim was important. The victim usually had cognitive disabilities such as dementia. A precipitating event occurred as the trigger which initiated the action taken against elder abuse. Macro-level systemic failures were mentioned, and this includes missed opportunities for prevention of abuse, problems in the legal system, failing to address the core issue, and instead arresting and releasing a perpetrator, which allowed a system of abuse to perpetuate. There was more legal involvement with the police than we expected, and there were several power of attorney cases that were described. But overall, we did find diverse examples of what constitutes abuse within these countries.
Preliminary interventions included surprising involvement of other family members being one of those, neighbors, and surprising at that, social workers and the police. There were increased social support services, counseling, and legal action. Again, Ms. Weaver said more than we thought at this time. For the perpetrators, there was legal action, counseling, and of course something we'd all recognize, nothing was done. Then the outcomes would be sort of these. For example, persons were less isolated because they received social services, they had better nutrition, and they had help with ADLs and IADLs. Victims were in safer environments often when they were relocated, and staff, for example, knew more about abuse and its prevention than prior to the event that happened. As far as prosecution, the perpetrator could no longer do more harm to more individuals or the individual or individuals who were abused, and the guardians, as good guardians, could be doing good surrogate decision making for the victim. And now I'll hand that off to Dr. Enitzberger.
Thank you, Pam. In going over my discussion conclusion remarks, there's two large categories of commentary I'd like to make. First of all, that research providing a global perspective of elder abuse is extremely important, but thus far has been quite limited. I think it goes without saying that we live in a global society where communications, travel, economics, and even terrorism served to unite us in ways absolutely unimaginable 40 years ago when elder abuse was first acknowledged as a concern in the United States and Great Britain. In this global context, elder abuse is no longer seen as a peculiarity of select developed countries as it was in those early days of proper recognition. Rather, elder abuse appears endemic to societies everywhere. However, evidence for elder abuse as a global phenomenon to date mostly comes from studies exploring the problem in a single country, or even more commonly, a single locale within a country. Multinational elder abuse research like this is rare. Yet I believe such research is critical to our global understanding in response to the problem, which is seriously limited. This was first noted by the World Health Organization more than a decade ago and echoed just last month by United States Assistant Secretary for Aging Kathy Greenlee at a meeting of the United Nations Human Rights Council when she said, and I'd like to quote her, "Elder abuse is a global crisis that demands a community of nations response. On a universal basis, we lack adequate data and insufficient investment in research." There are several preliminary findings, I think, that bear further scrutiny, and I want to begin with the overview. The victim profile that emerges from the 5 pilot countries is the same as seen in the earliest days of adult protective services 50 years ago. That is, a woman in her 70s or 80s residing at home in an urban community. If findings from the full study concur, I believe it'll become important to examine more completely the dimensions and dynamics of gender, age, residence, and even community type for what they have come to mean for abuse occurrence. Certainly there have been writings on gender as a correlate to elder abuse, but much less so on the others. Now turning to the preliminary themes, I'm going to talk about 3 things here. Financial abuse continues its reign as perhaps the most common elder abuse form, or at least the one that tends to draw us in as responders. However, it's notable that financial abuse typically does not stand alone. Rather, polyvictimization, as reflected in multiple abuse forms, is the norm among the case studies from the pilot countries. This makes all the more important work being done by the National Committee for the Prevention of Elder Abuse on this subject. Secondly, it's not surprising that family members are the usual elder abuse perpetrators emerging from the pilot results. This has been a common finding from elder abuse studies targeting community-dwelling older adults worldwide. What we sometimes forget, however, is that family members can be the perpetrators in residential settings like nursing homes as well. Stereotypic thinking about nursing home abuse puts the act in the hands of staff, particularly nursing assistants. A study like this stretches and reminds us that perpetrators of resident abuse can be anyone with whom the older adult has contact. And then the last point under preliminary themes, if there's one characteristic about the problem for which there seems to be widespread agreement, It's that the definition of elder abuse lacks boundaries, and examples seem endless. Whether this reflects diverse cultural perspectives, changing political agendas, or something else, the meaning of elder abuse continues to expand, and illustrative situations continue to multiply, as further revealed in the pilot findings. Although research agenda-setting forums since the mid-1980s have urged the universal adoption and acceptance of elder abuse definitions, clearly this has not happened. And then finally, turning to the preliminary interventions and outcome findings. The pilot results indicate that victims of elder abuse receive more and a greater variety of help than do their perpetrators, who sometimes receive nothing at all in the way of interventions. These results mirror other studies. There's also a very small body of literature which suggests that the perpetrators may be more likely to accept and benefit from services if only they were offered. Addressing perpetrator characteristics like substance abuse and financial dependency may be critical for preventing elder abuse occurrence or reoccurrence. Elder abuse laws and service models tend toward either criminal penalty for perpetrators or else focus mainly or exclusively on addressing the vulnerabilities of the victim. Research like this can spur a re-examination of these limited approaches.
Thank you so much, Dr. Essenberger. As you can see, it took many people to put this study together and bring it to our attention, and it's a lot for us to consider and a lot for us to build upon and move forward. Thank you so much. What an amazing team, and we'll look forward to updates coming from you all soon. All right, at this point in the presentation, we would like to move you into a panel discussion about the future of WEAAD. So many of our speakers today are just these most prominent people in the field, so please do go back and revisit, or we shall post all the biographies of all these speakers, because I don't want you to miss out the importance of what they are contributing. So we have now, first for you will be Greg Shaw, and after Greg has finished speaking, then we will have Trudy Gregory. Thank you so much.
Well, thank you and good afternoon. Look, it's a real honor and pleasure to be talking to the participants that are online today. I wanted to talk a little bit about the future of WEAAD, particularly in the context of where we're heading around the issue of rights for older people and issues associated with ageism. Late in 2012, the IFA, together with WEAAD, undertook a study of older and younger Canadians, looking at Generation Y, Generation X, those aged 46 to 65, 66 to 74, and those 75 plus, around issues of ageism. And it was really interesting, and I think these statistics are comparable probably in many other countries. In that 3 in 5 seniors aged 66 and over say they've been treated unfairly or differently because of their age. 1 in 3 Canadians admit that they treat someone differently because of their age. And the statistic goes higher, as high as 43% for those Gen Xers and 42% for Gen Ys. Half of Canadians say ageism is the most tolerated social prejudice when compared to gender or race-based discrimination. Canadians agree that seniors 75 and older are seen as less important and are more ignored than younger generations in society. And 7 in 10, or 71%, agree that Canadian society values younger generations more than older generations, and I think that could probably be said for many. 1 in 5, or 21%, which is, I think is a high number, say that older Canadians are a burden on society. So, you know, when I think about age, and age being just a number, I come back to a quote that Mark Twain once said: "Age is an issue of mind over matter. If you don't mind, it doesn't matter." But when I think of this, I think of the negative stereotypes of aging in the media. It's hard not to associate growing older with nothing but aches, pains, feebleness, lack of freedoms, or lack of mobility. These things contribute to our view of society and older people. And really we need to start thinking about how we look at and characterise older people. We generally value and respect older people we love or know well, but our attitude to other older people within the broader community can be different. In many traditional societies, older people are respected as elders. However, in other societies, older women and men may be less respected. The marginalisation can be structural, for example, enforced retirement, informal retirement, such as older people being viewed as less energetic or less valuable to potential employers. These attitudes are examples of ageism, the stereotyping and discrimination against individuals or groups because of their age. And it's certainly prevalent. We've only got to look at the language that we use today. If I go back to the study that was done, it was interesting what people are saying about discrimination they face. And the two that I really want to highlight here, which constitute 79%, is 41% see themselves as being ignored or invisible, and 38% state that there's an assumption that they have nothing to contribute, and that is far from the truth. How are we looking at the issue of protecting the rights of older people, and what are the issues? So certainly, despite all the awareness raising, we still fail to capture discriminatory practices. Age discrimination remains an issue. There are gaps in formal and informal protection mechanisms. There's a lack of clarity about protection, and there's inconsistency in the narrow range of rights. And there's certainly variety and varying standards across the globe when it comes to older persons. So older people do not necessarily self-identify. Evidence is absent, limited, or not available. It's an outdated conversation. Civil society is not well organised when it comes to the issue of rights. And there's a disconnection amongst stakeholders. Established by the General Assembly on December 21st, 2010, looked at the issue of an open-ended working group to look at the issues of ageing. The working group was to consider the existing international frameworks on the human rights of older persons and identify possible gaps and how best to address them, including the consideration, as appropriate, the feasibility of further instruments. So if we look at the current treaties, we've got the UN Universal Declaration of Human Rights in 48, the European Convention on Protection of Human Rights 50, the UN Convention on Economic, Social, Cultural Rights in 66, the UN Convention on the Elimination of All Forms of Discrimination Against Women in 79. But there's a real paradox, because while for many years we've known that there's issues around how to better around protection of older people, there's the soft law paradox. So in 82 there was the UN Vienna International Plan of Action on Ageing, 91 the UN Principles of Older Persons, 92 the International Year of Older Persons, and in 2002 the Madrid International Plan. When I think about the open-ended working group and the work that it's doing, so the 6th session of the working group will take place in New York on 14 to 16 July 2015. Now, if I make some correlations back to the convention which was adopted for the rights to protect people with disabilities, the dialogue started in 1981 to 1992, in which the decade of disabled persons was declared. In 1987, a global meeting of experts came together to review at the General Assembly. And it wasn't until 2007 that 159 states and 126 states ratified a convention after the first 5 years in 2007. So the reasons for a need for a convention for people with disabilities was really interesting. And the wording that was used was, while some countries have enacted comprehensive legislation in this regard, many have not. Because of discriminatory practices, persons with disabilities tend to live in the shadows and margins of society, and as a result their rights are overlooked. A universal legally binding standard is needed to ensure the rights of persons with disabilities are guaranteed everywhere. Now, I would argue the same can be said today for our older citizens. Let's hope that it won't take 30 years to better protect the rights of older people. Craig Malk, there of the UN High Commission for Human Rights, at the first meeting of the Open Working Group, made this statement: "The absence of a dedicated international protection regime for older persons continues to hinder the full realisation of their human rights." And those that are working with the open-ended working group probably couldn't agree more today. The High Commission, Navi Pillay, had made a comment at one of these meetings that what we must not accept is that old age brings it lesser access and enjoyment to the full range of human rights. And I think about the future of WEAAD and how we actually build it into the whole principles around better protections of older people and the rights that they should afford in society. And I think issues like discriminatory practice and ageism only lend themselves to instances of abuse globally. So thank you for listening to me, and looking forward to the rest of the presentations. Thank you.
Thank you so much, Greg. And now Trudy Gregory will present.
As Julie has said, I represent the National Committee for the Prevention of Elder Abuse, and we are a multidisciplinary national membership organization established to identify, prevent, and respond to elder abuse through research, advocacy, public and professional awareness, interdisciplinary collaboration, and coalition building. And those latter two are really the focus for NCP's work, because we truly believe that it's that multidisciplinary, interdisciplinary collaboration and the building of coalitions that bring more perspectives, more skills, a greater number of individuals together to work on elder abuse issues. And at the local community level, it brings more effective response to those individual cases of abuse. And that is really what our mission, not only is our mission, but it is what NCP's vision is for the future of World Elder Abuse Awareness Day. Because with greater collaboration and coalition building, we can enhance and strengthen the response to elder abuse. That can bring greater public awareness to the issues. It brings enhanced professional education, and the more practitioners we have who understand the issue, who can focus on the issue, the more we can have detection, the more we can bring the public into the issue, neighbors of older individuals into the issue. We can have greater detection, which can lead to better and enhanced investigation of elder abuse cases, which can then bring in victim services that can respond to all the different needs of an older victim of abuse, and also bring into play elder justice, which can look at individual cases, which we can not only with greater detection and investigation, identify where these cases are happening, we can begin to hold abusers accountable in a very real way, in a way that responds to the wishes and the needs of the older victim, but also to the laws of our communities, our states, our countries as we approach this issue. And when we have this type of collaborative response, it leads to wraparound services and response for the victims of elder abuse. So all of their needs are met. So there are linkages from one service delivery to another service delivery, and it's not dependent on the older victim to have to bring all these services into play, but the wraparound services and practitioners are bringing these services into play. And when you begin to have this kind of approach, then most importantly, there are no wrong doors for older victims in our communities and our regions. No matter how their abuse is detected, no matter who responds to that abuse, it then opens other doors of services and response to the needs of these victims. So what this really boils down to is when we look at World Elder Abuse Awareness Day, our greatest need, whether it's in your community, at the national level or at the international level, is a lack of public awareness and community support for older victims of abuse. And World Elder Abuse Awareness Day was instituted to help provide a solution to this problem. That solution from a NCP perspective is to create and sustain more community coalitions, more collaborative organizations that are looking at elder abuse in their area and coming up with a more interconnected, a more involved, a more multidisciplinary response to elder abuse where they are. An example of this comes from NCP's coalition and collaborative membership, the Maricopa Elder Abuse Prevention Alliance in Phoenix, Arizona. They have a lot of different needs that they work on, or issues such as alternatives to guardianship, a fiduciary abuse specialist team, certainly public and professional education in Phoenix, Arizona, in their community, and a number of community events every year, over and over, not just on June 15th, but over and over. They bring this issue in front of the community through special emphasis and events. The poster there is a poster that was developed by Maricopa County Elder Abuse Prevention Alliance for a recent Elder Abuse Awareness Day. And it's just an example of what can be done by a local coalition to respond to issues. And replication of these types of local collaboratives can really be the future of World Elder Abuse Awareness Day, because we truly believe at NCP that the impact of the future focus of World Elder Abuse Awareness Day is to bring this issue forward internationally, nationally, and at the local level. And when it is brought to the forefront, it will be felt, this effect will be felt not only at the national and international level, but more critically at the community level, where older victims are often living in the shadows. And on June 15th, every year, we not only look forward, but we have to glance back. And so I want to do that to close, because nothing encapsulates NCP's vision for the future of World Elder Abuse Awareness Day better than a quote from our founder, Dr. Rosalie Wolf, who says society must address the abuse of the elderly as a critical social problem. The lessons learned in responding to the needs of these individuals may serve as a guidepost for advancing the quality of life for all older adults and their families. That is NCP's vision for the future of World Elder Abuse Awareness Day.
Thank you so much, Trudy. That was inspiring. And now with their perspectives on World Elder Abuse Awareness Day's future, we are so very pleased to have Susan Summers and Dr. Alex Kaleche. Dr. Kaleche is calling us from Brazil, and Susan is also coming from afar, so we're just very, very excited to have them. Susan, would you like to begin?
I must say that I'm really delighted to be here, although not in person, but sort of virtually, with a number of the leaders that have brought us along these 10 years. Elizabeth Pozniak, of course, our founding individual for the idea of the World Elder Abuse Awareness Day, and Dr. Kaleche, who carried us right through the UN to our very first launch, and it's just very exciting to be here with them again today. Thank you for doing this, and thank you to Dr. Mosqueda. I just wanted to reflect a little bit on this commemoration, this 10th commemoration, that I feel we've really been moving from awareness to action. And INPEA has been working, as our mandate is, to develop a culture of respect. And so using this World Elder Abuse Awareness Day forum over the past decade, we've seen a change in the concept of elder abuse. It's expanded from seeing it as a form of family violence, interpersonal violence, domestic abuse grown old, and some institutional abuse, to looking at it through a human rights lens and taking a human rights approach, revealing the numerous normative and implementation gaps which really lead to the violation of human rights of older persons. And there's a growing realization that systemic ageism, as first identified by the focus group participants in Argentina in Missing Voices, the report of WHO and PEA that we've learned about already today, that was done in the early 2000s, is the root of most elder abuse, which must be addressed by systemic change. Thus, it underscores the need for us to implement an international instrument on the rights of older people. We need a new convention for the human rights of older persons. And there's many reasons why. The first one is because we don't have any binding document that speaks directly to older persons' rights. There's some discussion in some of the documents that actually Craig brought up, and there's some discussion in the CEDAW with a general recommendation on older women's rights. However, there is no dedicated protection for older persons' rights, and we need that. So, we're aware now that there are these clear gaps in protection in many areas that lead to elder abuse, such as issues in long-term care aren't covered, issues of palliative care are absent from the human rights standards, and there are other issues that are happening in several countries, unfortunately. There's issues of violence against older women and widows in particular. There's scapegoating, there's witchcraft accusations, and really some tremendous, horrendous violence going on against these vulnerable individuals. So, but in light of this, though, I'm encouraged. I'm encouraged because there have been many milestones that have been placed, and recognizing that many of those milestones were carried by advocates of NGOs. INPEA is an NGO. We're a non-governmental organization. We have consultative status at the United Nations, such as IFA, with Greg and Jane Barrett's organization, and Dr. Kalache in ILC's. And we work together and help to carry this heavy load. But some of the accomplishments I want to mention. We've already, I hope that we're all aware that on December 19, 2011, the General Assembly of the United Nations recognized World Elder Abuse Awareness Day as an international day of awareness. And it was made possible because of the many years of efforts of the members of civil society, you who work in the trenches, you who are hands-on with older persons, advocating with your governments, advocating with your leaders, teaching parliamentarians, work tirelessly to raise the issue of older persons using WEAAD as your forum. And if you hadn't reported in and sent your little reports and notes into INPEA and our website, we would not have had the data to present to the General Assembly through the efforts of Dr. Deichmann, Leah Deichmann, our past president, who happened to be very good friends with the mission of Argentina, who happened to be, along with Brazil, of course, and Chile and other nations, very supportive of working towards the rights of older persons. But we were able to give them data, worldwide data, showing how many programs and events had gone on, and show them that this phenomenon of elder abuse was worthy of their attention and support by UN member states. And so that was a very big day. Pat Brownell was there with me that day, and it was a very exciting, a little anticlimactic, because they just passed a resolution, and then we went on to do more work. We're not stopping for a minute. And along the pathway, we find what's happened. Things really have happened. There was the first invitation from UN Women for Dr. Brownell to participate in the International Women's Day, a first recognition. First social forum on elder abuse was held at the Human Rights Council in Geneva. We have the establishment of a group of Friends of Aging at the UN, another first. We have coming up, any day now, the first regional convention of the OAS, the Organization of American States. They've been working on a regional convention, and certainly the emphasis that's been put on to protect older persons and to come out with this convention, which should be signed perhaps on World Day. It's just very exciting, the things that are happening and the ripples and effect here. We have the first African Protocol on the Rights of Older Persons, an EU Charter on Human Rights. We have, in one of the very first non-communicable disease summits, Dr. Kalache was very instrumental, along with Mike Splain of the Alzheimer's Dementia International, in getting Alzheimer's recognized as the first time as a non-communicable disease, or within that group, and giving some attention to it. Imagine, they could have just ignored it if we hadn't had the support of these great folks. We're working on older persons in emergencies, and as you know, in the recent earthquake in Nepal, the devastation has been terrible. And of course, older persons and young children are the greatest, and women are greatest vulnerability. But on a good note, I got a note the other day from Dr. Gauri Shankar Das, with whom I traveled in Nepal when I did dementia training, etc., over a few years ago, and I was back last year. He traveled, he's like 80-something years old and very spry. He traveled way out to some village, and he saw hope where there was devastation all around him, and he sent us a note back to encourage us to keep heart that people are continuing to move forward. And with all of these things, all these good things that have happened, I see the future of WEAAD as really moving force, and I'll be very excited to see what happens in the next few years. And thank you all for everything that you've done.
And thank you, Susan. You certainly are a pioneer. What I'd like to propose we do, because we are running long, is that we bring it home with Dr. Pozniak, who has often been called the mother of World Elder Abuse Awareness Day. It's fitting for her to start and to close out her session, and if we should get Dr. Kalache to be involved, we will certainly try to bring him in at the very end. So, Elizabeth, would you like to go ahead?
Yes, of course. This has been such an exciting session, but we are getting out of time. So I'm going to be very brief and tell you two things that I really hope that will happen, that we will embrace in the next 10 years. And one is that we need to look at the program, the WEAAD program, and evaluate how are we doing and where are we going, and what are the good things and what things need to be changed. So that's one. And the other one is that I think we need, as many people do, to develop some thinking in relation to elder abuse. We've been borrowing, and now it's time to have our own theory. But most of all, I want to ask you in the next decade to look at the possibilities and the solutions for the problem that we have as our mandate. And two things that I'm very concerned about and like to work on social inclusion and empowering older adults themselves. I think we need to do more in having older people work on this, and that can be accomplished through pre-retirement courses and education of youth and others, so that we're all in this as a team, and the professionals aren't just the saviors in the problem. Also, I would like to ask people to have some fun and enjoy working on activities for World Day. They are varied, and having fun is good for all of us. The second thing is I would like to ask everybody to be hopeful, because hope pushes us forward, and World Day was built on dream work, and much of that has happened, but we need to continue it and to it, because this is what will move us forward. And our original slogan was "My world, your world, our world," free of elder abuse. And I think this is a concept that, until it's accomplished, remains the goal of World Elder Abuse Day. Thank you for being here. Just by being here, you all are part of the solution. And we cherish that and look forward to more of these discussions into the next decade of World Elder Abuse Awareness Day. Thank you so much.
Oh, Dr. Pozniak, thank you so much, and thank you to all the team. When Dr. Pozniak, Dr. Atzenberger, and Pam Teaster brought this to the NCEA, we were thrilled to be a part of it. It has truly been a privilege. So although our webinar is wrapping up, we are all really just ramping up to get going on World Elder Abuse Awareness Day. And what we really want you to look forward to is that there is the NAPSA Global Summit that is coming up at the SEC building, June the 15th in Washington, D.C. This is another great event that is going to bring this issue further and further into the public view, and so many amazing people are involved. So we hope you get that information there, and of course it's on our website at the NCA. Lots of information is there and available to you. In closing, again, it has been such a privilege, and I want to thank the NCEA team for all of their hard work, as well as the speakers today. And again, Dr. Kalechi, I truly apologize for not being able to get through on the phone line. It just happens sometimes with when we are far-reaching in the world. These are some of the technological problems that we might experience. And we will be sending out an evaluation form, so please do give us your critiques. This was our first attempt at this, and we hope to do more for you in the future, and we, of course, want to improve.